Welcome to the Learning Lab. I'm Roman Garcia. What we're going to be discussing today is issues that have to do with degenerative conditions of the foot or the ankle joint, specifically the ankle joint. And I'm going to be describing what is the most important bone in the ankle or in the foot, that if you are experiencing ankle pains or foot pains, that is the primary bone that when you go to have the area examined is the bone that the examination should focus on. So basically what I want to do is just show you what that bone looks like in a healthy state and then in a degenerative state, and then show you different examples of different conditions that afflict this bone. Now, the name of the bone is called the talus. Now, the reason that I believe that this is an important issue is that if you go onto YouTube or if you go on to any other social media platform, you're going to have many types of individuals or practitioners that are discussing all different types of ailments that can happen to the foot. The truth is that all the other ailments really does not matter, because what they're describing is issues that are very minor and very transient. But the most important bone in the foot is the one that they discuss the least. And I'm going to show you an example of what one of those videos would look like, describing these ancillary issues that affect the foot that are really of no great importance to an individual that's suffering from ankle joints or foot pain for that matter. Now, I just want to show you an example of one of those videos and how it would look like, how it would present itself. Now, if you allow me, we're going to go over here and I'm just going to show you a short session of what one of those videos would look like. Now, this is a particular video and how it looks and the description of it. Now, as you can see, the examiner, I covered the identities of these individuals just for privacy purposes, but you can see he's about to evaluate. He's about to evaluate his sample patient. Now, this examination, it has to do with the extensor digitorum longus and the extensor digitoriums. Now, he's describing this as an issue that afflicts the soft tissue of the foot. The truth of the matter is, I've been in practice for about 25 years and I've seen all different types of conditions that affect the foot, and I've really never seen a tendinitis of this particular tendon. Now, this video lasts about 14-15 minutes describing this issue that's really of no importance. Carlos, you can come to me now. Now, you can go on discussing this issue for another 1 hour or 2 hours, but the truth is that this condition, soft tissues of the foot, they do happen, but they're not very serious and they're usually resolved by themselves, needing really no medical examiner. But the most important bone in the foot is the one that's not discussed. And the name of this bone in the ankle joint is called the talus. It's T-A-L-U-S. It's the talus. This is the primary bone in the ankle, foot, that needs to be evaluated anytime somebody experiences any kind of ankle pains or foot pains. Once you disqualify this bone from being the tissue that's producing the symptoms, everything else is easy. But the problem is that this bone doesn't get the responsibility or the attention that it merits. So I'm going to show you exactly where this bone is on an ankle, on a human ankle, with the help of my assistant, Brisa. Brisa, you're going to lay down. Now, and I'm also going to examine you the biomechanical marker for this bone, and it'll give you an idea if this bone is going bad in your foot and your ankle, and if you should be concerned about it. Now, the talus bone is this. I circumscribed it here. This is where the talus is. It's a dome-shaped bone. It's in the ankle. It's the primary bone in the ankle. It's right over here. It pretty much encompasses a three-dimensional plane. It has a front, it has sides, and it has a back, and it has a bottom. Now, the way that you simply evaluate this bone right here is simply by just moving the foot back like this. Now, if you are examining, or if your foot goes back, if you bring your feet back like this, and one foot stays, one goes back, the other one doesn't go as far back as the other one, it's time to seek out medical intervention to examine this talus bone. It is not tightness of the gastrocs. It is not a soft tissue issue that usually or will prevent your foot from moving back. It's going to be the talus bone. The talus bone starts to undergo a degenerative process where it does not allow the foot to move backwards like this. As you can see, in Anna's case, both feet move back when I bring them back, when I push them back. Now, you may experience a little bit of tightness, and that has to do with the soft tissue. But if you, if you yourself try to bring the feet back, no, do like this to your feet, bring them like that. If you yourself bring your feet back like this, and one foot goes back and the other one moves back only a little bit, I can almost guarantee you that this talus bone is under duress. Now, Carlos, come over here. Let me show what an x-ray, what it looks like, and where the talus bone is on an x-ray. Now, what I'm going to show you is in decreasing order of involvement. I'm going to start from a normal looking talus and go all the way to what a very degenerative talus bone will look like. Now, this x-ray is an x-ray of Anna. We just took it. This is the talus bone right here. This is it right here. It's a dome-shaped structure. This is it right here. This is the talus bone. This is the most important bone in the ankle and foot. This is the bone that if you experience ankle pains or foot pains, when you go to the examination, the examiner should be focusing in on this bone right here. This is the talus bone. This is the heel bone right here. This is your long bones of the lower leg. This is your midfoot, and these are the toes right here. This is your talus bone. Carlos, let's go back to Anna. Again, what I just marked right here, this is where the talus bone is. This bone is the reason that you can bring your foot back like this. And when you cannot bring your foot back, that gives you an idea. It's a biomechanical marker of how involved this bone is. The less you're able to bring the foot back, the more involved this talus bone is. Alrighty? So let's go back to the x-rays. This is a normal talus bone. You can see through it. It's nice and clear. There's no degenerative changes on it. You got the joint space width right here. You got a good joint space width here. This is a normal talus. This is a normal ankle joint. Now, this talus bone, the actual bone itself, is still relatively healthy. You can see you got a nice dome-shaped structure to it. It is a little bit wider. You can see here it's a little bit wider, whiter than this bone overall. This is the Anna's ankle joint. But if you observe over here, you can see that the joint space width is becoming a little bit blurred. There's a little bit of stress in this ankle joint. The talus bone, though, is still normal. This foot, you would be able to bring the foot back completely because this talus bone is still relatively hydrated and it's not in a degenerative state. Now, this is a more involved talus bone. It's a little bit blurry, but you can see the dome-shaped structure to it. You still have it, still dome-shaped, relatively. You can see some degeneration here. You can see this extension of bone over here. This talus bone is under duress. You can see how white it is. The whole rear foot is white, especially the talus bone. This talus bone is very dry. It's starting to collapse, but it still has the dome-shaped structure to it. This foot, you would still be able to bring the foot back, but not all the way. It would be involved functionally. So it will be positive as a biomechanical marker, the bringing the foot back. Again, but it still has the dome-shaped structure to it. The joint space width is right over here. It's very compromised. It's very wide. Now, We come over here. Now, this ankle, this talus is starting to collapse. You still have the dome-shaped structure to it though, but it's not as pronounced. It's starting to flatten out. Look at the difference. I don't know if you can appreciate that, but look at the difference. See, it has more dome-shaped structure here than this. You still have a curvature here, but it's starting to flatten out. So this talus bone is starting to collapse. The joint space width, very compromised. It just so happens that this shot, this x-ray right here, was of a professional basketball player. And not very old either. He was in his 20s. Now, this is the end stage of a degenerative condition in the talus bone. This is the talus bone, or what is left of it. You can see it's completely lost its dome shape compared to this one. You can see its dome shape, it's flat. This is a collapsed talus bone, which is what happens in end-stage degenerative conditions. The bone, the talus bone, becomes so dry it literally collapses under the weight of the body. So this is a ankle that you wouldn't. This is a foot that you would not be able to even bring the foot back, not even a few degrees. It would be stuck in a neutral position. This individual will have a limp. He will be in tremendous amounts of pain. Again, you can see this is the talus bone right here. This is what's left of it. It's right over here. This is it. It no longer has that dome shape. So again, Carlos, we can go right back here. Now, this is what we've learned today. Whenever you have an ankle pain, whenever you have a foot pain, when you go to the medical practitioner, the only question you should need to ask that practitioner, that doctor, the physical therapist, the chiropractor, whoever it may be, is how does my talus bone and what condition is it? Now, the two questions you need to ask is it sclerotic? That means is the bone drying? On an x-ray, it will look very white. It will be very easy to tell. And is it collapsing? And you'll be able to tell by that dome-shaped structure to it. If it's starting to collapse, it won't have that nice curvature to it. It will have more of a flattened surface. So those are the two questions that you need to ask. Everything else that happens in the foot is all transient and it's really insignificant because they all have solutions. Now, a talus bone that's in a degenerative state is something that's very serious. So, again, when you go to your examiner, if they are not focusing in on the talus bone, then they are not doing their jobs. So it's best to be informed and to ask the right questions. And with any problems in the foot or the ankle, again, I'll repeat myself, the only two questions you need to ask that practitioner is, what is the condition of my talus? Is it sclerotic or has it collapsed? Now, for anybody that sees this video, if you have any input, if you want to speak your mind, please contact us through the video. If you have any questions about any of our past videos, please make your minds felt, send us a message, and until next time, thank you for watching this video.